Welcome, everybody. Happy National Ice Cream Day. Happy birthday to Taylor Swift, if we've got any Swifties with us, and Jamie Foxx, they share a December 13th birthday. We're going to give folks just a couple more seconds to settle in before we get started. Welcome, everybody. Welcome. Well, maybe what we can do is kick it off with some housekeeping items and get that out of the way. Thank you, Nancy. Chat should be open to all, so please feel free to use the feature to introduce yourself. We'll make sure that it's working. And if all goes well, we encourage you to use that feature to engage throughout today's presentation. We have reserved time on the agenda for questions, but I would like to encourage you to drop them into the Q&A as we go along. And if possible, please be sure to include the speaker that you would like to pose the question to. American Sign Language interpretation and closed captioning are available. Our interpreters will be spotlit throughout the presentation, but closed captioning will need to be enabled for anyone who needs it. You can do so by selecting the CC icon or transcript icon from your toolbar. And lastly, full disclosure, this session is being recorded, and we'll be sharing the link to that, plus the presentation and transcript via email. It'll also be posted to www.ccltss.org. I know we have a pretty diverse audience today, including a handful of out-of-state colleagues. So I thought that we can start the conversation with a very high-level overview of how we got here. In spring of 2018, West Health and the SCAN Foundation partnered to launch the We Stand with Seniors campaign, aimed at raising public awareness about the specific challenges of California's aging population. And that was really on the heels of a public survey that revealed some really interesting data about just how important aging issues were for California voters. That survey found that 67% of voters felt that California wasn't prepared to care for its aging population. And 83% would be more likely to support a gubernatorial candidate who had a vision and long-term investment plan to address challenges and increasing demand for services. Ultimately, then candidate Governor Newsom pledged his commitment to tackling these issues. And in 2019, upon his election, he signed an executive order for the development of a master plan for aging, or the MPA. The MPA was developed with robust input from stakeholders. They met for about a year and outlined over 800 recommendations for consideration. And then these recommendations were reviewed and organized by cabinet members into what we know as the master plan, which includes 5 bold goals, 23 strategies, and over 120 specific state-level multi-department initiatives for the first 2 years. But the ambitious goals of the master plan can't be achieved through state-level action alone. And recognizing the important role of California communities, the MPA features a local playbook that's geared towards supporting the development of local age and disability-friendly action plans. There are a number of local plans underway, each unique and responsive to their communities. And at the state level, we're looking forward to the next set of 2-year initiatives, which are under development with a target release date of January 2023. The California Collaborative for Long-Term Services and Supports is highly invested in the implementation of the master plan. Our members served on the Stakeholder Advisory Committee that developed recommendations, and they continue to serve on a number of committees charged with providing oversight and direction. On the local front, CCLTSS is working in partnership with the California Department of Aging and UCLA to create a baseline map of local implementation efforts. This data will be made available in early 2023 in alignment with the release of the MPA initiatives for years 3 and 4. And with support from the SCAN Foundation, we have launched a quarterly webinar series to create space for cross-pollination and learning across all of our regional efforts to develop local master plans for aging. This is the second webinar in that series, with more to come in 2023. So thank you for joining us. We're so delighted that you're here, and we really look forward to continued engagement and partnership as we work towards a California for all ages and abilities. With that, I'm thrilled to introduce the amazing Callie Peterson, Program Officer at the SCAN Foundation, who will give us a little bit of background on the initiative, the coalitions, and introduce today's speakers.
Wonderful. Thank you so much, Maria, and good afternoon, everyone. I'm thrilled to be here today to talk about our Rural Master Plan for Aging, or MPA, project initiative. The SCAN Foundation is a local organization for those of you in California. We're based in Long Beach, and we are dedicated to ensuring that older adults are able to access and receive both health and supportive services that they need and want in the setting of their choosing. Since 2011, even before the Master Plan for Aging history that Maria provided, we have been funding groups of advocates across the state to come together and work towards a better future for older adults. And the Master Plan for Aging, as Maria pointed out, is a perfect pathway foundation to support those mutual goals. We fund technically 20 regional coalitions. They cover 45 of California's counties, and they work hand in hand with the California Collaborative for Long-Term Services and Supports, the organization that is hosting us today. As Maria noted, we funded this new initiative, which is the focus of today's discussion, because we identified a gap, an important gap, a gap that found we didn't have a lot of examples or a firm path to support our rural partners as they endeavored to build local master plans for aging in their communities. So the SCAN Foundation has supported 3 of our regional coalitions. This includes the Diversibility Action Network, the Central Valley Long-Term Services and Supports, or LTSS Coalition, and our Inland Empire LTSS Coalition. And we partnered them with a wonderful consultant, Pauline, who will be speaking today as well, to borrow from other important work and to support the development of a process to support these rural communities to realize their own master plans for aging. The focus of this webinar is not me, so I'd rather move on to those that are doing the most important work. But here's a slide very quickly for those of you who are not in California to understand the specific communities that we are working with. So while each of our rural regional coalitions cover multiple counties, there are specific counties that they are working with in this initiative. So San Bernardino and Riverside, that is our Inland Empire Coalition. Kings and Tulare County, they are part of our Central Valley Coalition. And Shasta, Butte, and Glen are part of our NorCal Coalition. Hopefully that gives you a little bit of a mini geography lesson. But as you can see, they're very unique and diverse regions within the state. So this slide is really the power and muscle behind this work. These are the people that every day are serving older adults as well as people with disabilities as they try to navigate and again, achieve the realization of the services and health supportive services that they need. And we are ecstatic and grateful at the SCAN Foundation to be partnering with them on this important work. So from the Inland Empire, which again, that's towards the southern part of our state, that includes Riverside and San Bernardino counties, we have Anna Schwartz, Carmen Estrada, and Elizabeth Bogomil. In the Central Valley, we are very appreciative to be working with Helen Militides, as well as Dana Wild. And in NorCal, which again is the northern part of our state, we are very thankful to be working with Carolyn Nava, as well as Sharon Brizolara. And as I noted, just by first name, Pauline, she is our project consultant, but Pauline DeLang Martinez is navigating and charting this entire process for us. And with that, I think I can hand it over to Pauline, who takes over at this point. But I just wanted to say thank you to everybody who's tuned in today. This is a really important topic and one that we hope can be replicated in the future. Pauline?
Thanks so much, Callie, for that introduction, and Maria. It's really an honor to talk about our Rural Master Plan for Aging initiative. And as Callie just shared today, we're really going to focus on our process or our scope of project, sharing some early lessons that we've learned and our plans for the year ahead. So to kick off our webinar, I thought I'd start by providing a broad overview of our scope of project, and then we'll dive into discussing each step and what this has looked like so far in each of the 3 regions. We plan to share some early lessons that we've learned, as well as tools that we've developed that might be helpful for other regions that are working on developing your own master plans for aging. So starting with the first box on the top left of the slide here, our first step in our process was to form local advisory committees to lead the local MPA planning. The advisory committees include diverse representation from government, local health systems, and community-based organizations. We identified co-chairs and in some cases a steering committee to provide leadership. Next, our committees focused on collecting local data and conducting a local needs assessment by holding community listening sessions or focus groups. And at the same time, we've been working on building public awareness and supports for the local MPAs. For example, by presenting for local boards of supervisors and publishing press releases. As we're gathering data and community input, the advisory committees are beginning to brainstorm action items and identify resources to support implementation of the local MPAs. And by July next year, we aim to have a draft local MPA in each region, supported by elected officials and key community leaders. The action plans will be implemented by local work groups, and we're planning in-person public release events for fall 2023. And then finally, we hope to meet at least one short-term goal by December 2023 to help us to build momentum through early wins in the regions. So before we dive in, I want to credit the Center for Age-Friendly Excellence, also known as CAFE, for inspiring our scope of project. CAFE began using the same process to support age-friendly cities planning back in 2011, first with Los Altos and Los Altos Hills, who were the first age-friendly cities in California. And since then, CAFE has used a similar process to support 25 cities and 2 counties, Santa Clara County and San Mateo County, to develop age-friendly action plans. So now we're adopting CAFE's model to develop local master plans for aging in 3 rural regions. So as I mentioned, our first task in each region was to establish local advisory committees. And this process looked different across 3 regions. For example, in Northern California, the DAN Coalition was already an established convener and leader in the region. However, in the Inland Empire, the IELTSS Coalition experienced a change in leadership in 2020 that coincided with the beginning of the COVID pandemic. So it was challenging to rebuild momentum in that region. So I'm going to invite some of our regional leaders onto the screen to talk about their process of forming a local advisory committee. So if I can bring on Carolyn Nava from the Northern California region, Anna Swartz and Carmen Estrada from the Inland Empire, and Dana Wild from the Central Valley. So Carolyn, I'd love to hear from you first. Your region really hit the ground running. You hosted your first kickoff meeting in January 2022. Could you start us off by describing the process that you took to form the local MPA advisory committee in NorCal?
Yes, thank you so much, Pauline. Glad to be here, everyone. And you're absolutely right. We hit the ground running. We were initially approached about this project proposal back in September of the prior year. So for 2 months, my then co-chair, Sarah May, with the State Council for Developmental Disabilities, we really were more or less in a state of panic, to be honest, because the scope of what was being proposed was somewhat overwhelming. At the same time, we knew that the direction the state was heading was critical to play a foundational role in that and not to jump on the train at the last minute. To be honest, we wanted the e-ticket right. We said, we're going to get in at the foundation and we're going to make sure that we take into consideration what our region required as a very rural region. And when we say rural, we have on average in our northern counties that we service about 14 people for every square mile. So it is very rural. And to bring that energy together, we knew collaboration was important. It was not an overnight process. This is something that we had been building towards, that sense of collaboration. And if I emphasize anything else, it would be start with relationship building where you are. Because what's critical to a process of this nature is to have the true decision makers at the table from the foundation of the project. Use that as a driver to collect the accurate data that you were speaking about just a moment ago. And look for the key strengths of those leaders, because it was not about us as a coalition. The Diverse Ability Advocacy Network has been in motion for 12 plus years. What we required was to make those connections with the current leaders in our region and bring a common vision and common voice to the table. The master plan for aging gave us the platform for that. There was nothing we required to invent on the vision. It was already in place. So with the support of the SCAN Foundation, we looked for other talents to help us get this in motion right out the gate. And one of those talents you'll be hearing from in just a moment, Dr. Sharon Brisolera, who has been integral in our getting this done right and collecting the voice and collecting the appropriate information that will lead us into the future.
Thanks, Carolyn. And I'd love to now jump to the Inland Empire. Anna, if you could share a little bit about your process forming the advisory committee.
Hello, everyone. I'm Anna Swartz, and I am the lead for the coalition in the Inland Empire Long-Term Supports and Services Coalition. In 2020, my executive director, who was the lead of the coalition, retired in the middle of the pandemic. So it was on my shoulders to put this together. I had to basically start all the way over in the middle of the pandemic. I had to basically build our coalition from scratch. When Kelly approached us about doing the project, we almost backed out because it was so overwhelming for me, because I didn't know what I was doing at all. And so Callie talked us into it, and I thought about all the people who are in our rural areas. We do have, our counties are very unique because we have both rural and non-rural areas of the county. And I thought about all the rural areas of our county, and I thought they really need their voice to be heard. So I wanted to make sure that we got in there and got this done. Like Carolyn said, to be on the foundation of it is very exciting for me, especially because it's been like a project that I've done on my own. Like, I've had a lot of help, don't get me wrong, I've had a lot of help, but I've had a lot of help from different people in our county. And in both our counties, actually, one of the most challenging things I think is to have people constantly on the focus on the advisory committees, because people come and they go. When you ask people to be a part of the advisory committee, you want to make sure that they're going to have the time to invest, because the meetings are monthly, and if you get someone who's really high from the county that's really busy, you know, they might not be able to have the proper time to invest in this project. So that's one thing that I really recommend. Make sure, be very aware of who you're asking to be on the committees and who you're asking to be on your teams, because that's going to make a really big difference in the outcome of what you're trying to do. And I'm going to send it back to you, Pauline.
Thanks, Anna. And Carmen, you jumped in really to help Anna and to lead the advisory committee in the Inland Empire back in April. Can you also share a little bit about kind of your perspective on the advisory committee in that region and any lessons you've learned? And I know we're thinking of adding some new representatives to the committee as well.
Yes, thank you, Pauline. I want to say that Anna's doing a great job, though. So thank you, Anna, for inviting me. She was the one that invited me to participate in the committee, and so I'm grateful and thankful for her and all the work and effort that she's put into this project. So our IE committee is smaller than that of the other regions. We currently have 10 members, which include representatives from 7 different organizations, as well as Pauline and Elizabeth, who have been extremely helpful in helping us coordinate focus groups, seek new members, as well as helping us set some goals. We cover, as mentioned, San Bernardino and Riverside counties, which encompass a very large, huge geographic area. At the beginning, we really wanted to have equal representation from both counties. We thought that was extremely important. We wanted both counties to work together, particularly the area offices on aging of each region. We really thought it was important for both of those organizations, which is Riverside County Office on Aging and the San Bernardino Department on Aging and Adult Services, to work together. As mentioned, there have been various staffing changes at both AAAs, which has made it a little difficult to have consistent participation, as Anna mentioned. So a suggestion would be to get the names of 2 individuals per organization when you start putting committees together to join, so that, you know, if one is going to be absent, maybe the other one can step in. And the reason for that is because, you know, to have communication flowing, but also things tend to move very rapidly once you start meeting and you start trying to get focus groups coordinating and such. So it's really important to have individuals be present at the different meetings. And although sometimes participation hasn't been as consistent as we would like, something that has really evolved beautifully, though, is that through the coordination of focus groups, we have been able to find individuals who are very interested in the project and in the process, and that are really passionate about the community they represent. And so we have invited those individuals to join the committee. And these are individuals that are stakeholders, or they may work in different organizations. These are individuals that are advocates for older adults and are eager and ready to get things done, because you definitely need doers, right? People that are well connected and vested in their communities when working on a project like this. I would say, if you're starting an effort like this, to focus on tailoring it to your community. A larger group has definitely worked extremely well for the Central and Northern California areas, whereas a smaller group has worked for us in the Inland Empire. You don't have to start big right away. It's okay to start small, but you definitely want to find people that are well connected in the community and that are vested in the effort.
Thanks, Carmen. That was really helpful. You had a lot of good suggestions for other regions. So now we've covered the Northern California area and Inland Empire. I'm going to move over to Dana to share about Kings Tulare County. So your committee actually was the last to launch. I believe it was in May this year. Could you share a little bit about that process and any challenges you experienced along the way?
Yes, thank you, and welcome everyone. I'm going to actually start with the challenges. So when we first started to form our advisory committee, we really let politics get in the way. We focused too much on the who and not really the what or the why. So, and just for a little clarification, we are a AAA that's embedded into a county that's then embedded into a super agency. So there were a lot of layers and a lot of decision making of who should be on the committee. So again, the initial focus was on who versus the intent. When we really stepped back and were able to think about the master plan for aging and its intent, we were finally able to let go of the politics. And when I say politics, I mean that wholeheartedly. That this was not just a few conversations, but instead months of back and forth. We then focused on the organizations and not the people. What organizations are serving the older adult populations and those with disabilities? And then we dug even deeper and we thought about the subcategories, veterans, homeless. And once we had a really good list of those organizations, we then stepped back and focused on the people. We needed people that could make decisions, but also knew their communities and the people that they serve, and that they could offer good solutions and be able to participate in meaningful conversations. So we didn't just want necessarily the leaders of those organizations, but again, people that could make decisions. By focusing on the intent, I think we really got it right. We added a couple more organizations along the way as we identified our priorities, but for the most part, as everybody said, you want those people that are going to participate, that have the time to participate. And I think in that, by focusing on, again, the organizations and what they had to bring, and then focusing on the people, I think we got it right.
That's great. Yeah. And I know you also were really successful at engaging representatives from the Board of Supervisors from both Kings and Tulare counties, as well as I believe you have a city mayor on your committee and a city council person. So how were you able to engage these representatives, and why do you feel that's important to have as part of your advisory committee?
And again, this was another very big challenge and took a lot of massaging over the months. There was some backdoor conversations. We did presentations at our governing board, our boards of supervisors, and city council members. And we really tried to impress on them the importance of this project and what it could bring to the community, their community, the community that their kids are going to grow up and their grandkids are going to grow up in. And one thing I think that got lost on everyone is that we had people willing to step up and were ready to go when someone said, wait a second, don't those people have to vote? So we forgot about the whole voting process when it comes to adding boards of supervisors and city council members. So we had to step back, go through that whole formal process of agenda items and more presentations. And one thing I think that we did that I think was a huge success is we developed a fact sheet, and that fact sheet included a brief overview of the master plan for aging, what the advisory council will look like, who and what organizations they represent, the purpose and the role of the group of the members, and then their expected time commitment. We wanted to go in it with their eyes completely open, that this was not just something they could step in. It wasn't a political issue. This was something we needed. We needed their support. And I think that fact sheet really helped for them to be able to look at it, read it again. And then we constantly talked about that when we did our presentations, that, we needed them. And so we feel having representatives from the board and city council is important because it really sets the tone of importance. It shows the community that if these representatives are willing to step up and give their time, then it must be important. And they're also decision makers and have a much bigger voice in certain circumstances than others. They're also hearing firsthand the issues surrounding our populations, and was presented with opportunities, are in a much better position to share and ask for support. We are very lucky. The people that we have representing our group have already been big advocates of our older adult population and those with disabilities. So they've stepped in wholeheartedly. I don't think one of them has missed a meeting. And so again, we're very, very excited to have them, and they do bring a big voice to our advisory committee.
Thanks, Dana. I think that's so important to have those local leaders on the committees. Absolutely. So thank you so much, Carolyn and Anna and Carmen and Dana, for sharing about your advisory committees. I'm going to pull up my screen now. I wanted to share a snapshot of the different representatives on our advisory committees in the 3 regions for participants today. So I know there's a lot on the screen, but on the left side is kind of the high level types of organizations and agencies represented on the committees. And along the top, you'll see the 3 regions. So there's the Riverside San Bernardino region, Kings Tulare, and Shasta, Butte, and Glen. And what you'll see across all 3 regions is that we have representatives from the AAAs, the Area Agencies on Aging, the County Health and Human Services or Social Services, and the Independent Living Centers. And then we also have United Way 211 on 2 of the advisory committees. We have representatives from the health plans, community health centers, adult daycare, and CBAS. We also have representatives from the Alzheimer's Association, the Caregiver Resource Centers, transportation representatives, and housing representatives, which we felt like were really important for tackling some of the transportation and housing needs in these regions, as well as representatives from the LGBTQ advocacy community through the Stonewall Alliance, representatives of veteran services, and a local senior nutrition program. And then, as we just talked about, local government leaders. And so this is just kind of gives you an idea of the diversity of the different advisory committees and the importance of having so many different community voices. So our next step after developing our advisory committees was to gather and summarize existing data to understand the greatest unmet needs in each region related to the master plan for aging. And there are many different sources of data that could inform your local master plans. So for example, the Area Agencies on Aging area plan reports, which are updated every 4 years, community health assessments and community health improvement plans, which are typically conducted by local health plans and county public health departments. Also, each county and many cities also have a housing element that analyzes local housing needs for all income levels and describes plans for future development. And many counties also have a plan to end homelessness, as well as countywide transportation plans. AARP's Livability Index provides a great snapshot of community demographics, existing resources, and areas for improvement. And then finally, the California Data Dashboard for Aging and the California HHS Open Data Portal are both really great resources to gather county level data. In addition, during our very first advisory committee meetings, we asked committee members to bring forward relevant reports or data sources to better understand unmet needs in each community and also learn about local plans that are in place related to housing, transportation, or health improvement so that we could build upon and or complement other initiatives. In the Inland Empire, we hired a graduate student in gerontology, Samuel Leal, who summarized several local reports, and he presented those findings back to our advisory committee to inform our master plan for aging planning. And in the Central Valley, Helen and Dana invited advisory committee members to bring data from their information and referral phone lines to highlight what were the most common types of phone calls that they were receiving from community members. And from that data, we learned that food insecurity, housing insecurity, and caregiving were 3 of the top needs in Kings and Tulare counties. And those 3 topics became a major focus of the local master plan for aging in their region. So this brings me to our next step, which was to hold listening sessions in each region, engaging community members that represent diverse geographies and perspectives. We focused on engaging older adults, adults with disabilities, and caregivers with the goal of capturing perspectives from at least 50 individuals. To lead the listening sessions, we hired moderators in each region who brought experience collecting and analyzing qualitative data, and we'll hear from each of them in a moment. We also engaged the advisory committees to develop interview guides for the listening sessions, tailored specifically to the top needs in each region. You might recall that the California statewide master plan for aging has 23 strategies and 132 initiatives. And so for our local master plans for aging, we knew we wouldn't be able to cover all of it in each of the listening sessions. And so in each region, we focused on some or all of the topics that are listed on the slide here, including housing, transportation, healthcare, home and community-based services, behavioral health, dementia, caregiving, and or nutrition access. So to give you an idea, I put a link up here to view 2 of the interview guides that we used in Northern California and Inland Empire. And in addition, at the second link on the slide, you can view a summary of outcomes from our first listening sessions that we held in Northern California and Inland Empire. And these first listening sessions served multiple purposes. Holding the listening session with advisory committee allowed us to test the interview guide and see if there were any major topics that we were missing. And we also were able to capture the advisory committee members on unmet needs and potential solutions related to the areas that we were focusing on. And I see already in the chat, people are asking about the handouts, and we will be sharing these slides with all of you so that you can view the interview guides and all the different resources in the slide deck later on. So our next step after developing the interview guide was to engage the advisory committee in brainstorming key subpopulations that we wanted to target for participation in the listening sessions. We wanted to ensure that we captured the voices of diverse populations. So for example, in Northern California, the advisory committee decided to focus on IHSS caregivers and recipients, wildfire survivors, LGBTQ older adult veterans, Hispanic or Latinx older adults, Hmong older adults who were formerly incarcerated, Black or African American older adults, and also they held a listening session with the Area Agency on Aging providers. In the Inland Empire, they targeted similar populations for their listening sessions, as well as partnered with Carmen at the Caregiver Resource Center to engage rural spousal caregivers in a listening session. And they also are planning to convene older adults who are currently living in transitional housing to get their input. In Kings and Tulare counties, the advisory committee also chose to engage adults that are in their 40s and 50s. And for each of these subpopulations, we asked the advisory committee members to identify agencies and contacts that could help us to recruit participants. And on the slide here, you'll see a link to view our sample recruitment strategy documents that we created. So now I'm going to pass it off to Elizabeth Bogomil. She is our moderator in the Inland Empire, and she's going to share a little bit more about how this process worked in her region.
Thank you so much, Pauline. So I am going to review a little bit about how we've conducted focus groups thus far for the Inland Empire and San Bernardino, Riverside County area. We have done outreach. So typically the outreach takes the form of a flyer that is digital. It can be printed. We email them to the groups that we are collaborating with, and the oftentimes we'll help with the outreach. Sometimes we'll do the outreach ourselves. But because of safety measures and HIPAA rules and all of that privacy, typically they'll engage in the outreach for us. On the flyer, which we have a sample here for, we have contact information, a little overview of why we're having the focus groups, and who is able to participate in the focus groups or what particular group we're looking at for the given focus group that we're conducting. And so, like I said, that's shared with the group that's collaborating and helping us engage in outreach. Sometimes it's local senior centers, sometimes it's local community health centers, that sort. And then once that flyer is distributed, either physical copies or digital copies to potential participants, RSVPs start coming in. Typically they come in via phone or email. It tends to vary a lot. I get the RSVPs, they go directly to my voicemail and to a email that we set up through Gmail that is professional and doesn't appear to be from an individual. And so once those RSVPs come up, we either email them to ask for their mailing address. We share additional information like the Zoom link if we're doing a Zoom online focus group. And we also just confirm that they know the date and the time. About 2 to 7 days out, we do a reminder email as well to all of the RSVP participants, 5 to 7 of them typically, and just checking in, making sure they can still attend, and making sure they have the correct address, either Zoom address or in-person address, because we've done both forms of focus group. And we also have a consent form. The consent form is shared with the participants in the initial RSVP email. However, as I'll explain, we're typically having the participants verbally consent, either at in-person focus groups or over Zoom. But the consent form is really important. Having a strong one written up, we have a sample here. And it's important because it informs the participant for what they're participating in, how long the process will be, what they'll get in return, which for us, we've been given out gift cards in return, $50 ones, to those who participate, and also who has their information. So participants have asked example questions like, you're recording this focus group, where does that recording go? And I explain that recording's just for me as the researcher, and I use that recording to write up an accurate report. It's not going to be used in promotional material or anything like that. So this consent form breaks that all down for everyone. Next, we'll move on and discuss some logistics of coordinating Zoom focus groups, because we in our region, we've done both focus groups, Zoom and in person. So Zoom focus groups are good. We have an interview guide. Typically, I'm conducting the focus group, so I open the interview guide digitally on my computer on one side, and I've got Zoom open on the other side. And I have my recorder, which you can see, this is the exact recorder that I've been using. It's $60. It's really highly ranked and records great. The pickup is awesome. And there's nothing special needed. We can just put it in front of the audio and record it. You don't need to plug it into your computer or anything. And I use a recorder instead of recording directly on Zoom, because in our consent form, we specifically say that we'll only be doing audio recording. We're not recording any people's visual faces or anything. And that is important for them to know. And it's also important for us, because if we were to record additional identifying information, the consent form would have to be different, and there'd be different individuals may be more hesitant if we're recording their faces on Zoom. So that's why I use this recording device. Works out great. And then I also have with Zoom focus groups a legal pad next to me so I can take notes. And this allows the transcription and kind of overview of key ideas from the focus group to be really easy and quick after the focus group is done. So I've got everything summarized right there. I'm taking notes as we go. This is not as easy to do with in-person focus groups though. So on Zoom, we do verbal consent, which means I just call and I say, oh, okay, I thought the screen changed. I just call and I say, do you consent? And then they say their name and then they say they consent. And it's all recorded. So that's how we do consent. And then also something that we've had to consider is the use of closed captioning. The Zoom auto closed captioning, it works a little, but sometimes it can glitch. We've used it before and it has been useful, but we also encourage use of the chat too, if we need clarification on what's being closed captioned and what's coming out of that. So that's how we conduct the Zoom focus groups, and some tips there. I suppose one would not need Zoom as long as you have some sort of ability to do a visual chat. So Discord also offers that for free. There's other platforms that can be used if one doesn't want to navigate the licensing fee for Zoom. And so now we can move on to the in-person focus groups. So some logistics for in-person focus groups are considerations with having a printed interview guide. This is really important and something that, because I had been doing so many Zoom focus groups, I remembered the morning of, so we had to print out the printed interview guide with all the questions, so I know what to ask. And then we also did verbal consent. So I did print out and prepare for in-person focus groups having physical consent forms. That's a lot of paper, and I realized we can just do verbal consent. It's easier, same deal as with Zoom. Ask what your name is and if they consent. In addition to the recording device that we have here, the Sony one, I also brought in an Olympus all-around recording device. You can plug in the Sony recording device, and this is great. We were in a conference room for some of the in-person focus groups, and it has wonderful pickup, and you can also daisy chain several of these together if you have a larger focus group, like for community stakeholders. So this was great for recording. Also, we have conducted a couple of focus groups in person at facilities that are designated healthcare facilities, which means that masks are required. And then also we just want to have masks available for individuals who need to wear them and want to wear them. And we have this mask, it's the one that I wear. We bought a box so that we can give them to anybody who needs lip reading ability. Or wants to wear them. They're called the communicator, and they're not N95, they're surgical masks, but they have the plastic part in the front, so you can see people's lips and be able to read them. It feels a little goofy, but if everybody's wearing them, it's good. Also, two other things that are very important to remember, but I think kind of get overlooked, is having name tags can be really useful. Just a Sharpie and some "hello, my name are" name tags is really great, especially if you're doing focus groups where people may not be part of an established group and they may not know one another. And this has came in very handy. And then also having lunch available is really nice too. Typically when I conduct the focus groups, they've been from like 10 to 12. And then we have lunch afterwards, and there's outdoor courtyards where people can take their lunch. We've been ordering from Panera. A lot of people are excited about Panera when they hear that we're having it. So that's a good default place, but there's a bunch of other lunch places, maybe a local group that you work with to provide lunch. But this is a nice gesture too, in addition to the gift cards that we hand out. So for the in-person focus groups, we hand out the gift cards. And then for the Zoom focus groups, we do mail them out. And that's why it's important to have the addresses for the Zoom focus groups, but they're not necessary for the in-person focus groups. So that's basically how we've conducted the focus groups. And now I'm going to hand it off to Sharon, who's going to give you a bit more information.
Yes, thank you. Thanks, Elizabeth. We were asked, Carol and I, to talk a little bit about how we decided who would be part of our listening sessions. And really, in addition to, Dana had mentioned the importance of coming back to the purpose of this effort. And for the DAN Coalition, we were also really focused on the commitments that that coalition has to having a no wrong door policy, to strengthening relationships. So those values really led us to consider inclusion and equity in our decisions about finding partners, finding listening session participants. When we talked about the voices that should be at the table, the Dan Coalition members really had strong opinions about who needed to be represented, who was currently more underrepresented, and also to ensure that those voices could come and express what was important to their communities. We wanted to base our activities on looking at the values within the Dan Coalition and also what could reasonably be done with the partners at the table, the amount of money and time, resources that we had within the time frame that was being considered. We talked a lot about what was currently needed, as well as what partners were making deep commitments to areas of the master plan for aging. So in the end, we decided to focus on healthcare, housing, and transportation. In speaking about inclusion, certainly we were concerned with race, ethnicity, degree of rurality was an issue because there are some differences within our region: gender, class, sexual orientation, ability, those who were impacted by the justice system. And for our region, also those who had been most impacted. We were all impacted by wildfires, but those who had lost their homes and neighborhoods. So in addition to veterans. So together with the members of the Dan Coalition, we really leveraged our resources, our relationships, our partnerships in order to reach out to and strengthen our relationships with those with groups who had those populations, worked with those populations, or were coalitions themselves of those populations. So the members themselves reached out to some of the groups. In some cases, these were new partnerships to us, or partnerships that the group had been trying to build. In the case of one local church and a cultural center as well. It required a bit longer than we had planned for in terms of explaining the initiative, explaining who the Dan Coalition was when that wasn't already a known entity, and building trust. So one of the things that has come up in the process is our recognition of just how important that trust building piece is and will be to the kinds of efforts that we want to accomplish. We've learned that the follow-up, well, we knew that follow-up would be important, but we've come to understand that some additional ways of following up with residents were desired. So in terms of input, we've had input from a really wide range of groups, more than was necessary in terms of the scope of the work initially. But it was really a commitment of the Dan Coalition to go, as Carolyn says, over and above in order to widen that input. There's the efforts that we've made, the reaching out, the recruiting, we see as all part of the relationship building and of the collective efforts that we're strengthening through this as well as other projects. We've found also in terms of sharing that our groups, even though they were all present for the listening sessions, both the group members and others who had helped us to recruit folks were very interested in the highlights from their own particular session. They were interested in the overall findings and outcomes. But we're really interested in having reinforced what was said in that group. They found that useful and helpful. One of the findings we'll talk about later was just a reinforcement of the lack of awareness of existing resources that are. So another way that we followed up was to make sure that concerns that were raised during the group or a desire for particular resources that already existed, because Carolyn was present at all of the sessions, she would speak to some of those information needs. She would follow up with an email about other resources, and very often would speak to the groups on invitation afterwards about additional resources available. So that kind of reciprocity and sharing has become an important part of our follow-up, as well as relationship building. So as we're continuing to gather data, and Pauline mentioned some of the other sources of data that exist, we are looking forward to an event in the spring where we present, but also use that opportunity to get more input from the community. We're considering perhaps a larger survey, other ways of having, allowing for more voices. And another strategy that we're thinking about is more of a collective interpretation, where some of the findings are put forward and residents can be engaged in a participatory way in helping to determine what some of the interpretation means. What are some of the meanings, as well as some additional recommendations. We found that participants had some incredible recommendations that we'll be including in our findings. And so with that, I'll turn it over to the next speaker.
Well, hello, everyone. I'm from the Central Valley, and we had every intention on starting out doing focus groups like the other two groups. And what happened was one of our advisory members said, we're having health fairs, and we're doing a Mexican Independence Day, and we're having a senior center opening. That might be a great place to come and interview older adults. So we thought, why not? So we ended up doing one-on-one interviews. And when it came to our interview guide, on one hand, we had our members saying, well, you have too many questions. And on the other hand, we had advisory members saying, you don't have enough questions. And it ended up being a rather, I would say, extensive interview guide. It took people about an hour to actually get through the entire survey. And we ended up designing two different surveys. The first survey was for the older adults. And the great thing about doing it one-on-one is that it really did allow for sort of more in-depth questioning, and it allowed for privacy on behalf of the person who was responding. And it gave us an opportunity to probe a little bit more and just gain a real understanding of their personal lives and how their lives connected to people in their community. And we also developed a survey for professionals, and that one was more broad-based, and basically we were asking about their opinions and their experiences that they saw in the field of aging. So as I said, we did a health fair and a couple of local events, and how we ended up recruiting was we got a booth and we sat there, and as people walked by, we said, would you like to participate in the survey? And of course, we had to explain what the survey was and tell them a little bit about the master plan, and explain that it was going to be used for planning purposes and not particularly for research purposes. And people were just randomly willing to participate, which I found that kind of surprising. Also, we had some advisory council members who had set up the health fair and the senior center opening, and they pointed us or pointed people into our direction as well. So they were very helpful. We did end up having only Spanish speakers, especially during Mexico Independence Day event. And we had to rely on interpreters. There were some case managers and some social workers who sort of worked within the Department of Social Services who were there. And they sat with us and helped us work through the interview, which is really great. We were definitely targeting rural areas. That was something that our group was very passionate about. And I think I put like 600 miles driving around over 2 weekends. And what was really interesting about going to these rural areas is that we ended up meeting so many people who were not connected at all to social services. Many of these people did not have transportation. They didn't have internet. There would have been no way to actually reach them unless, you know, we met them where they were. So that was really good. And one of the things that I found that was just really encouraging to me doing it this way is that when you have these people walking by, you really don't have any demographic information about them. You can basically guess, okay, this person is over the age of 50, but you don't know anything about their background. And randomly, as they're participating, they were just naturally falling into our subpopulations. And many of these people were falling into more than one subpopulation. And just from randomly interviewing people, we were able to connect to the people who were our targeted subpopulations. And while we might not actively consider that a result, to me, it makes me think about how widespread needs are in rural communities. It's one thing to interview a caregiving group. The Kings Tulare Area Agency on Aging had one, for example. It's another thing to go out in the community and meet people who are providing care and don't even identify as caregivers. Just really goes to show how I think how widespread and how deep the need is. And I have up there that we also gave gift cards and had a consent form and all of that. Mostly what we did a bit differently is that we did these one-on-one interviews, and we sat at health fairs and in the park and interviewed people as they were walking by. So I am going to turn this over to Pauline now.
Great, thanks so much, Helen and Sharon and Elizabeth, for sharing about the process and how that looked differently in the 3 regions. And I know all of us have been really busy with collecting data, and we're really eager to bring these findings back to the advisory committees to inform the planning for the local master plans for aging. And I also we wanted to take this opportunity to put a plug. We're planning to host another webinar, possibly in the spring 2023, to report back some of the findings across these rural regions of California. While there's typically been a huge focus on parts of California that have more population dense areas, but according to our State Office of Rural Health, there's over 800,000 adults age 65 and older that live in a rural census code in our state. And that's more than the entire populations of Wyoming, Vermont, Alaska, or North Dakota. And as far as I could find, the most recent publication focused on rural aging in California came out in 2011. So there's a great need for this type of research in our state. So I'm wondering if I can bring all of you back on screen together, Elizabeth, Sharon, Carolyn, and Helen, to just give a little teaser of some early findings from your listening sessions. So we can start with Elizabeth.
Hi, y'all. So just for context, thus far we have conducted 5 focus groups. We have one that's scheduled for January, and 4 of them have been on Zoom and 1 of them has been in person. The one in January will be in person as well. So we have conducted the focus groups on low income, English and Spanish speaking caregivers, African Americans and Black individuals, and LGBTQ identifying individuals. The findings are still preliminary because we haven't been able to reach out to all of the subpopulations yet. But we found an exceptional desire to build closer social support communities amongst those 65 and older in various and diverse ways. But we found that need and that desire to create those support communities. And that also may be because of COVID. It's come up in quite a few focus groups, have kind of broken a lot of those ties that existed before, and they're looking to reconnect those ties. Additionally, there's been a desire to have more centralized one-stop shop resources, whether it be a single office or whether it be an ombudsperson or whether it be a 1-800 number, where an individual that can actually connect them and help them go through the process. Some even suggested regional social workers that were able to meet at the library, had an office at the library that could connect them to resources. That was really, really important. And then another theme that's came up across several of the focus groups was just because a resource exists and just because people in the county who are facilitating a resource know it exists, doesn't mean that aging adults know about the resource or that they know that they're eligible. How to navigate that eligibility, sometimes that's confusing. For any age, that's confusing. And then also how to navigate getting access to a resource, even if it does exist. So those seem to be the key themes, that last one especially. Just because we know a resource exists doesn't mean everybody else in the community does and knows how to take advantage of it.
Definitely. Yeah, that's been a key theme, I think, across all 3 regions. Helen, can I turn it to you? Could you share some early findings from your interviews?
Well, I can share one thing. So I think we mentioned that we were looking at nutrition and housing and caregiving. That was our main focus, but sort of due to the nature of our in-depth interviewing, we found results that we weren't looking for. So, for example, we found several respondents who were struggling with mental health challenges. And, even though we asked about Alzheimer's, the issues that they had were depression, and they had been struggling with it for a very long time. And it was unaddressed because they lived in a very rural area and there wasn't any transportation. So, and this person also had some housing challenges. But what we found was just the link between these various areas of need. It's not as if you can sort of address one, but then that one issue is causing another issue, which is linked to another issue. So there's, I think, a lot of linkages that we need to be aware of, especially in rural areas, which are, I think, based on just the lack of resources. And in this particular one, there was just a lack of clinical staff to help people who were struggling with mental health issues, and they couldn't go to the next biggest town or drive a county over. And then the other thing that we discovered, and I think I've already touched a little bit about it, was how sort of widespread the needs are. Even people who you would take a look at them and think, okay, you're fine. and you're getting along fine. But no, there's another issue. So for example, we interviewed this one older lady, and she was employed part-time. She was bilingual. She was educated, and you would think, okay, everything is great, but she was providing caregiving to her husband who had heart issues, and she was helping. She was helping one of her sisters who was in a nursing home. And when I asked her if she needed any help, she said, no, I'm fine, until we start talking about housing insecurity. And then it turns out that she has to walk down the street to go take a shower at her sister's house because she can't get into the bathtub and lift her legs over. So it's just interesting when you start digging all the challenges that people are overcoming. And I would say that is a positive thing about what we found in our county, was just this very independent streak, which can also be a negative if you need help and you're not asking for it.
I remember you also talking about intergenerational needs, like that the younger generation's needs was greatly affecting the older adults as well.
Yeah, that was something else that we found. We found a lot of people who were living together.
Mm-hmm. Thanks, Helen. And now Sharon and Carolyn, I'm not sure which of you wants to speak, or both of you, to share about some early findings from your listening sessions.
Carolyn, would you like to go first, or would you like me?
Absolutely. It's interesting. We're a perfect pair really to do this kind of work, because Sharon focuses quite a bit on the data analysis, and I seem to focus on the human emotion of what's coming to the table. So I really relate to what Helen and Elizabeth are voicing, and we're finding a lot of commonalities throughout such a large geographic area. I'm going to just share one or two real life comments, no names, but these are comments coming from individuals that we have personally spoken with, that I think say it all for what we're all addressing. With housing in the mix, because I see there's a Q&A with housing. This comment came in from our northern Shasta County. If we don't own a home, we either have to live in housing, low-income housing, or basically nothing at all. Even our two incomes combined, we couldn't afford to live in an apartment in this area. For transportation, Sharon mentioned a little bit earlier, the wildfires, the firestorms that we've experienced prolifically in our region. This comment came in. We had to evacuate when the fire came. It was quite traumatic. My husband was on oxygen. I had to pack all that up, all of his medication, the dog. It took us over 2 hours to get off our street. We left at about 6:30 that night and got to my daughter a half hour away at 1:30 in the morning. Okay, these are real life situations. One more, once I pay the bills, I said, I can't even afford the cars. I can't afford this. People don't understand. I did make money when I was younger, but the money's gone. These are real people. And so for me, being there at these listening sessions was critical to my role as the chair of the Disability Advocacy Network. I felt like I required to understand the real pulse of this region in order to even begin to respond and to help this advisory committee that we've collected together also get a real sense of the heartbeat of our community. We knew what we wanted to focus on, but I think what is surprising for all of us, especially as service-oriented individuals coming to the table, we really felt like we were getting somewhere. This is helping us to be more targeted with the services that we're providing. And as a result, it's bringing more in-depth conversations to the table, more collaboration in the region coming into 2023, so that we are better organized to effectively put in place what the master plan for aging and the spirit of it is about. So I'll pass to Sharon. You're my savior, Sharon.
Well, and I'll just say that and this is probably true for the other regions too, that the final results will also have some of those key illustrations, the quotes, the voices of people within them, because they are so important. And a couple of things that struck me about the data was there was a lot more voicing of discrimination experience than I think we had anticipated, as well as some really strategic, innovative practices. So there are clearly some large, and as Helen mentioned, overlapping needs, but there are also some often tiring and often burdensome, but incredible strategies and innovations that people have put into place that I think when we're looking at both the strengths and the needs together will be important to highlight. There's certainly some experience of stigma of mental health issues and behavioral health issues in general, as well as addiction that people experience. The other thing, we share some in common from what Elizabeth and Helen were sharing, but among our transportation issues, other themes that we haven't spoken about yet came up was just the need for access to transportation for firewood and propane and a lot of things in our outlying areas that are really important for taking people to other services as well, and the cost of that, maintaining the number of people needing those cars. And in addition to not knowing about some of the resources that were available, there was an issue of needing more trust with those services. Individuals feeling not completely safe with some lesser known resources that were available there too. So bridging that gap, having someone who could help navigate what is out there, how to access it, what does it mean, what does eligibility mean, is it worth my effort to go through those processes? Those were some of the kind of supports that people were interested in having.
Thanks, Sharon. That was really interesting, and I can't wait to dive more into these findings. I think it's so important for a statewide audience and a national audience, and also for the local regions to inform the local MPAs. Really appreciate you sharing these. So I'm going to pull up my screen again and go to the next step in our process, which was to build public awareness and support for the local MPAs. In Northern California and the Central Valley, representatives presented for the county boards of supervisors about the statewide MPA and also the importance of developing the local MPAs. And you can view a recording of Carolyn's presentation for the Butte County Board of Supervisors at the link on the bottom left here, if you'd like to see an example of how that type of presentation looked. In the Central Valley, Helen and the advisory committee published a press release in a local journal, and we're working on press releases in the other regions as well. And then finally, in the Inland Empire, the advisory committee is working on planning a virtual meeting with a broad group of about 300 community stakeholders to present early findings from the listening sessions and invite additional input before we finalize the local MPA. So step 5 in our scope of work was to brainstorm action items to include in the local master plans and identify resources and support. And we plan to include at least 1 short-term and 2 long-term goals in each local master plan for aging. As we're considering what action items to include, we're staying informed of statewide and local initiatives that align with our focus areas. For example, the local master plans for aging should complement and/or build upon statewide initiatives such as CalAIM, the Dementia Care Aware Initiative, and efforts to address healthcare shortages such as the Community Health Worker and Promotora Initiative, CalGrow's Caregiver Workforce Enhancement Initiative, and others. On a local level, the advisory committees in Northern California has been inviting guest speakers from local initiatives to present at the monthly advisory committee meetings. So for example, they invited Dr. Mark Steeman from the South Chico Community Resiliency Hub to present about local efforts to aid in long-term recovery from the massive wildfires in the region, as well as other extreme weather events and disasters related to climate change. As Carolyn and Sharon talked about, the fires in their region have exacerbated challenges related to housing and healthcare access for older adults. And so it was really valuable to have Dr. Steeman come present, and so that our advisory committee could learn about his local initiative. On a statewide level, the MPA has been a catalyst for many non-traditional partnerships. And so we really hope to replicate that on a countywide level as well. For example, as we mentioned, we invited representatives from housing and transportation sectors to serve on our advisory committees. And as we begin to decide on our local action items, we want to continue to ask ourselves if there's other partners that we should invite to participate in developing the local master plans. As we're brainstorming action items, we're also tracking funding opportunities. For example, RFPs from the state, ARPA funds, the AARP Community Challenge Grant, or fundings from private foundations that can support implementation and sustainability of the local MPAs. And we also want to consider in-kind resources within our advisory committee and low-hanging fruit. So for example, in the Inland Empire, for one of their action items, the advisory committee hopes to update and distribute a local resource guide for community members. And that specifically is in response to a theme that, as Elizabeth shared, came up again and again in our listening sessions, which was the fact that community members are frequently unaware of what services are available in their region. Another low-cost action that came up both in the Central Valley and the Inland Empire is to improve referrals across counties and across agencies. And finally, as we're brainstorming action items, we want to learn about what's been successful in other communities. So here on this slide, I included several links to opportunities to learn from other communities, including AARP Livable Communities topics, as well as their portal, which is a really great way to connect with other communities. The World Health Organization has their database of age-friendly practices. We found a really neat toolkit from Australia on recovery to the wildfires there that was relevant to our work in Northern California. The Dementia Friendly America action plans, groups such as the American Society on Aging, the Gerontological Society of America, and the American Public Health Association have great best practices to learn through newsletters or different interest groups. And then there's some links up here specific to rural aging and rural communities. For example, through Grant Makers on Aging, the AARP Rural Lab, and the University of Wisconsin published a really interesting toolkit as well. So step 7, once we decided on our 3 action items, we're working on drafting our local master plans for aging. And this will include clear objectives, strategies, and assigned responsibilities. We'll create implementation work groups, identify leaders, set target dates, identify inputs and resources. And we also plan to develop a logic model and proposed evaluation metrics. We want to ensure that there's buy-in from key community leaders, such as county boards of supervisors. And as Callie got us off, started off today, she talked about the SCAN Foundation's ongoing support of the regional coalitions that bring together aging services providers and other key stakeholders. And that coalition structure is so essential for sustainability of the local master plans. And finally, once we have our master plans for aging put together, we're planning public release events in each region. These are all set to be in person or hybrid events, and we're really excited to get together and celebrate all the work we've accomplished and continue to build public support for the local master plans. We're hoping to get some press coverage and invite elected officials to present. And it'll be a great time to announce our local implementation work groups and recruit additional community stakeholders to participate in those. So we made it through our full scope of project. As you heard today, our local MPA work is just getting started in these rural regions, and we've been heavily focused on our listening sessions and gathering data to inform the local master plans. We have a lot of work ahead of us still, but we have really great advisory committees that are passionate about moving the process forward, and we really appreciate the support of the SCAN Foundation and the California Collaborative for Long-Term Services Supports in the California Department of Aging. And with that, I'm going to turn it back to Maria to facilitate our audience Q&A. I think you're on mute, Maria.
The faux pas lives on. Thank you so much, Pauline. And I think I'll ask Nancy to start spotlighting our other panelists. And really just wanted to say congratulations to all of our presenters today. You guys did an amazing job of condensing what is a tremendous amount of work into a short amount of time, and really appreciate your thoughtfulness and all of the insights that you provided. I know we're running a little bit short on time for Q&A. There were a couple of questions that were submitted, so I kind of want to focus on those and maybe turn to all of you to share, some advice for other communities who are beginning to work on their local master plans. So I know in the Q&A, there was a question about whether there was any focus, or did you hear anything from the listening sessions about the missing middle? The missing middle is really those individuals who don't qualify for public programs, but also can't afford supportive services on their own. And so I'm wondering if anybody wants to just jump in and Elizabeth, you've shared a couple things, so maybe we can spotlight you. And
yeah, so this actually came up in one of our more recent focus groups, where an individual was explaining, it was at a public healthcare facility, and they were explaining that they didn't qualify for several things that they really, really needed, because they were just like slightly over the income threshold. And they were trying to figure out if there was some sort of safety net that could, maybe help the people who just didn't barely qualify. And once they had waited a couple years, I guess they had become eligible. But they had to wait a couple years for care that they couldn't wait a couple years for. They needed that care. It was a frustrating experience for them. We also had people who shared their experience, exact same focus group, about having to spend down their retirement because they had a little bit of retirement saved up. They had to spend it down. It was like $1,000. They got new rug for their double wide trailer so that they could be eligible for certain public assistance supports. So that has been encountered quite a bit. And it's hard because some groups do have a safety net. I'm noticing some services do, but others don't, and you're just out of luck if you don't qualify. It's very hard to hear that.
thank you so much, Elizabeth. And I want to recognize Carolyn, you've got your hand up as well. So go ahead and jump in.
Thank you so much, Elizabeth. You're absolutely right. We definitely run into that continuously and ran into that with our listening session scope of project. One of the things that we are now emphasizing through our Independent Living Center on an aggressive campaign is outreach related to preparation, not just having a go bag when the firestorm hits, but more specifically financial preparation for emergencies, because most don't have it. The good thing for us with our independent living structure is that we do serve all income ranges. So we make it a habit of connecting with the more regional or localized resources that are not income dependent. By far, there aren't as many as there are for those who are living in poverty. And to be honest, there's a lot of money floating around out there right now for everyone. So it's about reaching out, which is not always easy for someone who is not in a positive place emotionally, mentally, or physically. So our outreach has become the catalyst for getting these questions out there and getting our community connected to resources. There's a lot of participants on this program today that are a part of that outreach effort for us, including our area AAAs, area agencies on aging are also a great resource that are not income dependent. Things like United Way are not income dependent. So it's about that initial getting connected so that you can get pointed in the direction that's most effective for you.
Thanks, Carolyn. There's also a really interesting question from Clay about rural-based agencies tend to be understaffed and under-resourced. So how have you found staff and funds to take on the MPA project? Does anybody want to jump into that? Anna. Is it Anna or is it Anna?
It's either. It's Anna, but it's either.
Thanks.
So actually, Callie from the SCAN Foundation has we are funded through Callie and SCAN Foundation, and so we haven't been able to do everything that we need to do for this project under that the SCAN Foundation. That we're sticking to the budget because we have to make sure that we have money left over for the event that's happening next year. That's really important. We had money to pay for our focus group leader. We had money to give out the stipends to do, the lunches, all that stuff. So that's how we've been able to fund all this, is through the SCAN Foundation.
Thank you. And Carolyn, I know that you put something in the Q&A about how you've dealt with that. And so I'm wondering if you would like to jump in and share.
Sure. Hi, Clay. It's been a while. Nice to see you on the program. I did drop a few suggestions in there. It is, I mean, I'm serious. There's a lot of money floating around out there right now. And mainly it's just taking a little bit of time to research your projects to see what it may be connected to out there. What is it connected to out there? So that you can begin that process of bridging multiple sources. And yes, along with Anna's comments, we have had great support from the SCAN Foundation, but I want to add that having that support from a foundation like SCAN opened up other avenues for us. For example, when we have live events, our connection to the SCAN Foundation often gets us in-kind donations of things like meeting places, resources, food donations. So it's sit down, map out what you want to emphasize and find what matches it, because there's a lot floating around right now, especially since the COVID lockdown and reopening. There's money literally everywhere. You just want to find it and match it up as quickly as you can.
Thanks, Carolyn. And related to that, I do want to turn for a second. There is a webinar coming up tomorrow about an upcoming grant opportunity. So in 2022-23, the state budget allocated $4.5 million to the California Department of Aging to provide competitive grants to up to 36 communities to support the development of their own community level age and disability friendly action plans. And the department is seeking input on the development of that grant program. So I'm going to see if Jacqueline is still with us. And if we can just put you on the screen for a second and hear from you, that would be lovely.
Hi, everyone. Jackie Tompkins here with the California Department of Aging. Can you all hear me okay?
Mm-hmm.
Wonderful. Thanks, Maria. You definitely summarized it up. We are going to be launching a local aging and disability action planning grant program in early 2023. And we do want to hear from our partners and stakeholders across the state to help us shape the elements that will be included in those competitive grant opportunities. So yes, we are hosting a webinar session from 10 a.m. to 11 a.m. tomorrow, Wednesday, December 14th. My colleague Amanda Lawrence put the Zoom webinar link into the chat. If for some reason you're not able to make that listening session, we're also going to have a survey. So you can input some feedback and your thoughts to that survey in the event. Maybe you can't make tomorrow's listening session, and we'll have all this information posted on the Master Plan for Aging website. So hope you all can join us tomorrow. Thanks, Maria, for making the time.
Thank you so much, Jackie. And then with that, I'm going to look at Pauline for a second. I know we're over by about 5 minutes. And so I'm wondering, for those that are hanging in with us, if we could do lightning bolt rounds of advice for others who are looking to develop a master plan. I like a sentence or two at most. And I don't know, we started out the webinar before we went live doing a popcorn, and maybe we could do another round of popcorn. But Pauline, if you could, if you don't mind leading us through that, that would be fantastic.
Sure. Yeah. So I think two top thoughts is, one, forming the advisory committee with key stakeholders and the doers, like we talked about earlier. And also that community input is so essential. I will popcorn it over to Elizabeth because she's next on my screen.
Wonderful. I think the advice that I would give with concerns to like focus groups and that sort, that's my area, would be, don't just source potential organizers for focus groups from members of the committee. Go out and pursue individuals and groups that maybe exist beyond the committee. So if you have a group from the LGBTQ group in your local area, but you need to connect with veterans and you don't have a veteran representative on that group, go out and find yourself a veteran representative and ask them to help facilitate and engage with the focus group and organize that. Just because they're not part of your group doesn't mean they won't participate, and maybe they'll become part of your group.
You want to popcorn it over?
Oh, yes, I will bump over to Carmen.
Hello. My suggestion, we hosted groups for Spanish speakers specifically. So when you're trying to reach individuals of diverse populations, really tailor the invitations to them, personalize them. We placed a lot of effort in making sure that our letters were in Spanish, that we did a lot of follow-up. Each group may require a different form of outreach. So be flexible with the types of outreach that you do, depending on the groups that you want to get. So like I said, for our Spanish speakers, it was a little bit more involved, but it had great results, right? And then also make sure that, you know, the individuals that you invite, let them know there is going to be like a launch or something, and invite them so that they can feel included in the process and they can feel like their voices were really heard. So that's, you know, feedback that I have. Oh, sorry. I missed it. I'll popcorn it over to Carolyn.
Thanks, Carmen. Great comments. I agree. We dealt with foreign languages as well in our grouping, and made sure we had translators, all of those details. I would say collaboration is what leads the path. Create an inviting environment for your advisory committee. Let that identified master plan for aging, common vision, drive the talent and leadership that you have brought to the table, and then just let them fly. And will popcorn to Sharon.
Yes, those have all been great comments. And the other thing that comes up for me is flexibility. You know, we one of the things that we realized with reaching out to new organizations is that there was time required for them to get to know who we were, what we were going to do, to understand how this would affect them. So there was a lot of conversations and pre-meetings that were also important to the values of the coalition and to the ultimate success of the project. And also the flexibility, although we talked about having an hour and a half, very often in a focus group, we would wrap up at an hour and a half, but say there were people who wanted to share more. And so we would wrap up, allow people to leave if they wanted to, but many people would choose to stay longer And those were often really important comments that were made, but felt very respectful, and an opportunity to listen more deeply to the group. So that flexibility in allowing for surprises and relationship development. And I'll popcorn it to Dana. Have you gone?
No, I have not. I'm going to sort of expand on what others have said. And I think that's just getting out of with the advisory committee is getting out of your network. I think it's super easy to just go to the people that we always go to. And I think you really have to think way beyond that. What do you want your community to look like, you know, in 5, 10, 15, 20 years, and invite those people that, again, maybe you've never had a relationship with, and reach out to them, because they bring a completely different new perspective that we need if we're going to be successful. And then also, I'm sorry, I'm going to add that, and that fact sheet, I will say again that that was a big success, because it really, really provided the information that someone needed to make an informed decision, and you know, understand the time commitment, because this is not something, again, that you can take lightly.
I think we have Helen and then
Helen, sorry, I'll go ahead and
Well, these are all great comments. It's hard to add anything to everything that you've already said. But what I would say is it might appear that this is like a really daunting process. But I just want to encourage all the listeners that there's already a lot of existing resources that people can look at in order to get questions, for example, for the interview guide, like the AARP community survey, for example. And the other thing that I would say is if you can just find one person and talk to them about working on this project, it will grow. You will be pleasantly surprised at how many people are actually interested in improving their community for older adults.
Anna, you want to take us home?
In closing, I would say my biggest strength is having a great team, especially Carmen. She's really pulled me through. So I would say to identify a strong ally and really just work with them, because we're on a separate committee. We're like the chair committee, and it's really helped to have that extra, you know, strong representation from Carmen. And also I was going to say too, with our also big partnerships in the community, we have a partnership with IAP, and they're offering to give us the fees. So like if you have that kind of thing, you should really make the budget work, you know, especially if you have people who want to, you know, be involved and donate. So that's also a very good advice, is to make sure that you have partnerships in the community with people that you can really rely on.
Well, thank you all so much, and I appreciate the folks that stuck in. I know we're over time. This has been such a thrilling discussion, and we are so excited to bring these coalitions and Pauline back in the spring to hear a little bit more about what really surfaced in those listening sessions. So hang tight. We'll share that information as it becomes available, and certainly we'll be swinging back around next week with a link to the recording, the presentation. We hope that you share it far and wide. Really, this has been a tremendous resource, and please feel free to reach out to the collaborative. We can connect you with anybody who's here today and beyond to learn about local MPA implementation efforts. Thank you, and have a great rest of your week, everybody. Bye-bye.
Thanks so much.